For the last 30 years, I've tried to understand why some organizations are more effective than others in providing services to youth, families, individuals who have different needs. And during that 30-year period, we've conducted studies all over the country, nationwide studies, regional studies, that have focused on trying to identify the factors that distinguish the most effective organizations from the least effective organizations that provide social services, mental health services, and other kinds of human services to children and youth and individuals. That research has led really to two different parallel groups of studies. One effort has been to understand how we can describe organizations that are more effective than others. That group of studies has focused on organizational culture and climate in an effort to identify the kinds of organizations that are most adept at providing services. What we found is that these cultures and climates vary greatly among organizations, even organizations that provide similar services. And that you can think of the culture and climate profiles of these organizations somewhat like you can think of personality profiles of individuals. And we found that those personality profiles of these organizations have a significant predictive ability in determining how much people benefit from the services they get from these organizations. These culture and climate profiles impact these organizations by affecting the morale of the people who work there, by affecting staff turnover, by affecting the extent to which these individuals personally engage in the services that they're providing to these individuals. And all of these things end up impacting outcomes for the services. And the other effort has focused on how can we help organizations that aren't so effective become more effective in providing services. That research led directly into our efforts to develop intervention strategies that could be used to improve the culture and climate profiles of these organizations in a way that would have direct implications for improving services. That model, which we call the ARC model, has been tested in several randomized controlled studies, and we continue to work on that model to make it more efficient and effective in helping organizations develop the kind of cultures and climates that will result in effective services. Our most recent efforts have focused on developing a system for disseminating the ARC organizational intervention model nationwide so that organizations throughout the country can benefit from strategies that we developed to improve the culture and climate of organizations that provide services to children and families.